Hello everybody, myself Dr. Keshav Dada Kale, Senior Interventional Cardiologist and Head of the Department of Cardiology at Medicover Hospital, Navi Mumbai. Today we will speak shortly regarding the interventional treatment or operative treatment regarding the heart disease. There are many heart diseases which require the surgical treatment or interventional treatment. Some diseases will require only the medical treatment. So today we will speak regarding the heart diseases which will require the interventional procedures. Most important procedure in heart disease is coronary artery disease. Coronary artery disease means there are blockages in the arteries which supplies blood to the heart. And when we treat these blockages, it requires some interventional treatment. Like for diagnosis, it will require coronary angiography. Coronary angiography is a procedure in which put the dye in the heart and will take the pictures in big machine, which can give 100% result for diagnosis of the coronary artery disease. Once we diagnose the coronary artery disease or blockages in the heart, the treatment is we have to go for angioplasty. Angioplasty is we place the balloon in the lesion site and we put the stent and we fix the stent at the lesion site. It is called as coronary angioplasty. There are many types of coronary angioplasty. Simple angioplasty mostly it will not require the many instruments. But in complex angioplasty means when patient has multiple blockages, when patient has severe calcification or when patient has tortuosities in coronary artery disease, it will require the special instrument for treating the patients. In complex angioplasty, the instrument required are IVUS. IVUS means intravascular ultrasound. OCT means optical coherence technology treatment. Then it will require rotablation. Rotablation is the machine which cut the calcium. And orbital atherectomy. This is also the machine which will cut the calcium. And lastly, IVL. It is intravascular lithotripsy. It breaks the calcium and it makes space to place the stent. So these all instruments are used in the complex angioplasty. Then in heart disease, there are other things which are structural. Means this diseases which are coming from at the time of birth only. Most commonly are holes in the heart. Means patient has either atrial septal defect, ventricular septal defects or PDA. We close all these defects, ASD, VSD and PDA with catheters only, putting the mesh-like structure or devices in the heart. So we close ASD, VSD, PDA with devices. Then second thing is valve replacement. Mostly in patient who has heart disease and who has degenerative heart disease at old age, there is affection of the aortic wall and mitral wall. Aortic wall affection is called as aortic stenosis and mitral wall affection is called either mitral regurgitation or mitral stenosis. So when there is a degenerative affection of mitral wall and aortic wall, we can change this wall with the catheter only or through catheters only. When we are changing the aortic wall through catheter, it is called as TAVI, transcatheter aortic wall replacement or transcatheter aortic wall implantation. When we are changing the mitral wall through the catheter, it is called TMVR, means it is a transcatheter mitral wall replacement. So these procedures are high-end procedures in cardiology and we are doing all these procedures through the catheters only. Then another structural heart disease is left atrial appendage closure. In left atrial appendage closure, there are patients who has stroke or high risk of stroke when patient's left atrium is dilated. So we close this left atrium. It is a part of the left-sided heart with the devices. It is called left atrial appendage closure. Another diseases in the heart are degenerative heart rate rhythm or rhythm-related diseases. Like patient has sinus bradycardia, complete heart block, or patient has tachycardia. All these rhythm-related heart diseases can be treated with devices. So treatment for this sinus bradycardia or complete heart block, degenerative complete heart block are pacemakers. So we are doing pacemakers, either it is single chamber pacemaker or double chamber pacemaker. If patient has tachycardia, means there is increase in the heart, or patient has structural heart disease, it will require to treat this tachycardia like ventricular tachycardia with devices like ICD. So we put ICD through the catheters only. Then when patient has heart pumping is decreased, means patient had dilated cardiomyopathy, there are special devices are required This is called CRTD or CRTP. These devices are like pacemaker that increases the pumping of the heart. And lastly, there are some diseases related to the heart, but they are present in the periphery, like kidney, brain, and other structures. This can be treated with the catheters. So these diseases, if patient has renal artery stenosis, we are doing renal angioplasty. If patient has carotid artery stenosis, we are doing carotid angioplasty. If patient has blockages in the peripheral arteries like legs and limbs, then we are doing the peripheral angioplasty. So all kind of procedures related to heart, related to peripheral arteries, related to carotid arteries can be treated with the instrument, and these procedures are done through the catheters only. There is no single incisions present over the body. I think this is the magic of the non-interventional cardiology in managing the patient who has heart diseases. Thank you.